My name is Mario de la Cruz. I'm one of the editors at the Intima. We'd like to welcome all of you here to Bowery Poetry, and thank you so much for making it this evening. This is actually our 6th time here, and we are very fortunate to have had this collaboration be ongoing. We'd like to start with a few thank yous. So first of all, thank you to Bowery Poetry. Maybe a quick clap for their staff and the beautiful space Special shout out to Julius and all of his hard work in coordinating. Nikhil, and also one of our co-producers this evening, Nicole Charlotte, who's up at the front. She's been greeting you when you've been coming in and handling all of the door stuff, but she's been amazing and has communicated with many of our readers over email. A second round of thanks are necessary for Columbia University and the program in narrative medicine. For those of you who are unaware, the Intima grew out of a student group from the Columbia University program in narrative medicine, and from there we've been able to continue to do this very important work, and we're very grateful for their support throughout the years. Along with that, again, the staff at the Intima, all of the editors that work with us each and every time dedicate so much of their personal time to both the reading, the editing, the comments, feedback, voting, and very deep discussions about each of the pieces that end up being selected. We are fortunate enough at this point to be receiving over 500 submissions per issue when we put together the Intima. It's a very long labor of love that we engage in for about a month and a half of both reading through the pieces, finding the gems that are available to us, and then discussing what's going to be best for each issue. So we really appreciate all of their hard work and dedication as well. This evening, again, is a first for us, and I want to again mention Nicole and her role in coming together and working on a charitable donation and a charitable event for us to be able to come together as the Intima and think about how the work that we're so often receiving is so reflective of both the experiences of patients, family members, caregivers, and most of all, healthcare providers who are often struggling with very complex situations, and one of those, unfortunately, can be suicide. And as a result of some of the issues that we've been discussing as the members of the Intima this last year, we decided that this would be a wonderful opportunity when Nicole brought it to our attention to partner together and say, how can we maybe raise money for a particular cause and make sure that we're drawing more attention to some of these critical issues. So to speak a little bit more about that, I'm going to bring up our managing editor, Ms. Donna Bolseco. Please give her a round of applause. And she's going to talk some more about our collaboration this evening.
Thank you, Mario. Welcome, everyone. I'm so glad you were able to come on this Sunday afternoon. First, the chill is in the air, but there's a lot of warmth in this room. We were really excited to get together our contributors from the fall 2018 issue and also spring. And we thank you all for coming here, some from far away. We felt that when we were talking about this, as Mario said, we thought that the American Foundation for Suicide Prevention was an organization that aligned with us very well. A little bit about narrative medicine. In 2000, Dr. Rita Sharon coined the term narrative medicine, and to designate medicine practiced with narrative competence to recognize, absorb, interpret, and be moved by the stories of illness. In that same year, she established a program in narrative medicine at Columbia University. And graduates in that program in 2010 started Intima. Mario was one of the founding editors, a journal of narrative medicine. And along with publishing 2 issues a year, we do events like this one. So we're particularly excited again that this is our first benefit that honors the American Foundation for Suicide Prevention. Amy Monahan, who is the New York City area director of AFSP, just having a fundraising event today, sent this message to us. The American Foundation for Suicide Prevention is so grateful for the support the Intima community has shown us. Funds from events like today go to further our mission in our community. AFSP is dedicated to saving lives and bringing hope to those affected by suicide. We create a culture that's smart about mental health by engaging in the following core strategies: funding scientific research, educating the public about mental health and suicide prevention, advocating for public policies in mental health and suicide prevention, supporting survivors of suicide loss and those affected by suicide in our mission. And if you heard the piece, Cause of Death, that was read by Yuli, that was about a doctor who experiences a coworker, another doctor who commits suicide. So pressure in the high-stakes environment of medical training can be overwhelming. I wanted to share a video that the Mayo Clinic and the American Foundation for Suicide Prevention did that explains how everyone can help suicide by being alert for the signs of depression and escaping stress and how to be most helpful. It's titled Make the Difference, Preventing Medical Trainee Suicide. It gets the message out in an empathetic way. And it was one of the reasons our editorial board chose AFSP as an organization that we wanted to honor.